Commonwealth's attorneys and I have concluded that the NCAA sanctions were overreaching and unlawful.
Someone's got to develop a product that you and I as a consumer are going to want to buy.
Our country needs a comprehensive energy plan.
Welcome to another edition of For the Record. Healthcare has been a topic of discussion nationally, statewide, and locally, but for a number of different reasons. Healthcare today is a topic of discussion because of a potential merger between the Lewistown Hospital and the Geisinger Health System, and to talk about it is the CEO and President of Lewistown Hospital, Kay Hamilton. Kay, welcome to For the Record.
Thank you very much.
Let's talk first and foremost, let's talk about Lewistown Hospital itself. How old is the Lewistown Hospital?
Lewistown Hospital began in 1905 with 8 whole beds.
And it is no longer 8 beds, I would take it.
No, it is no longer 8 beds, 123 today.
And how many, a hospital that size has to be a large employer, I would think, in the area?
Actually, we're the #1 employer in the area. We employ a little over around 1,000 people altogether.
1,000 people at the Lewistown Hospital.
Yeah.
And there's still a nursing school, I take it, there?
There was a nursing school that closed in the 60s.
Okay.
We reopened it in 2005, so there is now another diploma program at Lewistown Hospital. Currently, we have about 50 students enrolled in that program, and they go for 22 months, and they are issued a diploma and are eligible to sit the national boards. And I am really proud to tell you the last 2 years, we've had a 100% pass rate for the national boards.
And are they LPNs or RNs?
No, they're registered nurses.
Okay,
Yes.
all right. And you also come from that background as well?
I certainly do. I'm a diploma grad myself.
And how long have you been with Lewistown Hospital?
Since 2001.
And you became CEO when?
March 2007.
Now, starting from 2001 through 2007 and now, what kind of changes have you seen since you've been there?
Oh, gosh, there's been so many changes, it's hard to recount them all. Lots of changes in staff, lots of changes in programs, and growth in the hospital, particularly in areas of specialized services, such as the hospitalist program. That's been a huge change for our hospital, wherein we have internal medicine physicians on duty 24/7. Very few small hospitals can have that, and it's really helpful to the staff and it's helpful to the patients.
Now, you described Lewistown Hospital as a small hospital. However, the region that you cover is quite large. Talk about how big that area really is.
It's pretty good size. We cover Mifflin and Juniata counties, of course, and then parts of Center County, Snyder, Perry, Huntington, covering about 80,000 lives.
And what I've always thought about with the hospitals, you travel 322, certainly from the top of 7 mountains till you get down outside of Perry County. You're really the only hospital in that area. If there are traffic accidents, are you the first emergency room that people go to?
That's correct. We're the first sole community hospital in that region, and that would be the first area they would go to, yes.
And one of the other things about being a rural hospital, you have to look certainly at the reimbursement from Medicaid, Medicare. How much has that impacted the bottom line at Lewistown Hospital?
As every CEO of every hospital will tell you, and particularly rural hospitals, it has impacted everything dramatically. We know that we're trying to reduce the deficit. Unfortunately, reducing the deficit means a lot to healthcare providers because we're one of the biggest users of federal dollars. So yes, that's impacted us dramatically.
And because of those, what other challenges you have to face because of that reimbursement?
Well, again, we face, because of that decrease in reimbursement, we have to look at how can we continue to provide the services that we provide and grow services. That's the real issue, trying to grow services on a limited budget, and is one of the big reasons that took us in the direction that we're now headed in terms of the merger.
And one of the things that you have to deal with that other hospitals don't, you have a rather large Amish community that you have to service as well. What kind of challenges does that present to you?
We do have a large Amish population, and we are very happy that we've been able to respectfully deal with that culture and learn the things that they need to have us understand better in order to take good care of them. And we also have been able to offer to them a self-pay policy that we offer to anyone who doesn't have insurance, not just the Amish.
That was part of what I was going to ask.
Yeah.
There probably aren't many self-insure or health-wise covered Amish out there in the community.
No, there aren't. They usually pay in cash.
And what are the other types of things you have to deal with there in terms of their religious beliefs or anything like that? Are there problems in that way that have to take care of them?
It is, I wouldn't say a problem, but it is a concern because some of their beliefs are things that are difficult for clinicians to understand. For example, they really don't like to be transported, and certainly not by helicopter. So if there's something that's happened to a child, for instance, and we feel that child needs to be life-flighted, that's problematic for the Amish. And we try to work with them as best we can. But on the other side of the coin, The clinician wants the very best for the patient.
Now, being a rural hospital, you have a J.C. Blair right up the road from you, also Tyrone, but you're really surrounded by some ever-growing larger hospitals.
We are. We are. We have faced a great deal of competition in recent years from Pinnacle, from Hershey, from even MountNittany. So competition is out there, and that helps us to be better every day.
And one of those things that you have to compete for is finding quality physicians and also nursing into your facility, correct?
Correct. Finding the physicians is a big issue. Finding nurses for us is no longer a big issue because of the School of Nursing. I'll give you an example. In 2003, we were spending over $1 million on temporary nurses because we didn't have enough nursing staff, and that's a year we were spending that. We don't have any temporary nurses in the hospital today because of our School of Nursing. Finding those specialized physicians, though, has been a tremendous burden for us for a lot of reasons, one of which, of course, is the money to do it. Another reason is having enough physicians that they feel like they have support. You don't want to be the only urologist in town. You don't want to be the only neurologist in town. You want to have a support system, and that's been very difficult for us to do, and one of the primary reasons why we've embarked on the merger path as well.
Now, I'm sure there is some way you find these doctors. It's not like they're going to careerbuilder.com and you're not listing a job position, correct?
Oh, we have a physician recruiter. We do everything that is known in the business to attract physicians. And we do, I think, I have a very good package for physicians as well. We do everything everyone else does. We help them pay off their school loans. We have a sign-on stipend. We meet the salary requirements that any other hospital meets. So I think we do well for that. We actually recruit well. We recruited 2 pulmonologists last year, which is very, very good. And we've recruited a number of family practice physicians in the past couple of years. So it's not that we haven't recruited anyone. It's that we cannot get the numbers that we need, the depth and breadth of resources that we need. We're probably short about 15 physicians.
And how do you, is there a ratio that you look at in terms of identifying those medical professionals?
We look at several things. One is the needs of the community. What are the diseases that are prominent in your community? And for us, of course, cancer, heart disease, lung disease. And then we look at the age of our existing physicians and how long they want to practice, and we plan according to those kinds of things.
And when we come back, more For the Record with Kay Hamilton. You're watching For the Record on WHVL. Back with more after this. Welcome back to For the Record. We're discussing the possible merger of Lewistown Hospital with Geisinger Health System. Kay, let's talk about some of the features that are at Lewistown Hospital right now, some of the services that are offered. First and foremost, the one that jumped out at me was the pain center.
Yes.
What types of work are involved in that?
Well, we have an anesthesiologist who's board certified in pain as well as in anesthesia, and she runs a clinic for people who have pain problems. And it's a very popular clinic. She's busy every day, all day long, trying to treat people who are trying to live with chronic pain.
Is it more of an arthritis, fibromyalgia type of situation?
No, it can be just about any cause, and so basically looking at various modalities to try to treat the kind of pain the person might be having. She can do various interventions. Some of them are injections into the spine. Some of them are things that help cushion the spine. So there's a lot of new things and treatments out on them that today are very helpful to people with pain.
Another one that we talked about in the break, the sleep center. A lot of people don't realize the importance of proper sleep at night, not just the amount of time, but also proper sleep.
So very true. In fact, not getting enough sleep that's proper sleep, as you put it, can lead to a lot of diagnoses and a lot of problems medically speaking. So if you're having any issues like that, it's a really good idea to go through that ordeal and be tested, go to the sleep center, spend the night, and find out whether or not you need some treatment for that problem as well. People who have done that tell me, I've never done it, but people who've done that tell me they feel 100% better. It
is actually an ordeal. It's interesting the way you call it, the way I've had to be a part of that. Also, your oncology unit, Lewistown, you've marketed your cancer care for a long time. Let's talk about that.
Oh, good. I'm glad you brought that up. Cancer treatment for us is a primary service that we render in our community because cancer is so prevalent in the area. And our cancer treatment center is one of the best around. I'm not just the only person saying that. People who visit our cancer treatment center, surgeons, doctors, all tell us the same thing. We have state-of-the-art equipment. We have staff who are credentialed and boarded in all the specialties that they need to be boarded in to do radiation oncology and things of that sort. So we're very proud of that service, and we urge people don't travel. If you live in the area and you need radiation therapy, I hope you don't, but if you do, then look to the Cancer Treatment Center at Lewistown Hospital because we have everything you need. You don't have to go anywhere.
Now, do you have external beam radiation there as well?
We do.
And that's part of the oncology department?
Absolutely. Yeah.
Okay. The surgical center, you talked about having enough surgeons. How many surgeons do you have right now? How many do you think you need?
Well, we have 3 general surgeons, but there are lots of other kinds of surgeons, vascular surgeons, orthopedic surgeons, urologists, and so while we have a good representation of most of those, we don't have enough to cover 24/7 every day of the month. So we're looking to, we actually partnered with University Orthopedics here in State College to help give us coverage, adequate coverage for orthopedics in Lewistown. And we have that almost covered, but not completely. So it's a matter of getting some other specialties and then covering some of the specialties that we do have.
And certainly the first thing that people think about when they go to the hospital for treatment would be the emergency room. And like we talked about 322, and also the area that you cover, that's probably the first place people really have treatment, correct?
That's absolutely correct. Actually, the ED is our front door because that's where most people come into the entire hospital. And it's like every ED in the United States. It's overcrowded, and we're working and hoping to be able to, when the merger occurs, to be able to have a brand new ED that will serve the needs of our customers much, much better than the one we have now, which is very small and very old. And so we're looking to see that change a lot going forward.
Now, what kinds of things can you do to alleviate all the overcrowding? Is it just a question of building a bigger area?
Actually, the topic of overcrowding in EDs is a very huge one, and there's a lot of factors in it, one of them being the fact that all people don't have insurance. But the most important fact is it's a matter of access. People cannot access physicians, they turn up in the ED. And so that's what's happening across the United States that's causing the large wait times that people talk about. I had to go to the ED and I sat there for 4 hours, and those things are very distressful, and we don't like it either. And we're trying to find better ways to handle that, because when people go to EDs for a cold because they can't find a doctor, then that is part of the reason why we're so overcrowded.
And is that probably because of insurance coverage issues? Is that why they choose the emergency room rather than a physician?
It's insurance coverage, but more importantly, they can't find a doctor.
And I know certainly the clinics, the outpatient clinics have popped up anywhere. Has there been any discussion about any Lewistown creating a clinic outside of the hospital itself?
We would love to see some sort of urgent care clinic. We've not had the breadth and depth of resources to do that. We're hoping through the merger we can do that, because that is one way of handling this problem to make everybody feel a little better, where you really only have the emergent patients in the emergency room and the other patients in the urgent care center, and everybody's happier.
Now, you've discussed, the topic of discussion certainly is the merger over there. Who approached whom about the idea of becoming a partner?
Well, it started a good 2 years ago, actually, when a group of our board officers and senior management attended a HAP seminar in Harrisburg and began to learn about the changing structures that were coming in healthcare, the Affordable Care Act, the deficit reductions, all those things. And it was an awakening for us. We realized, wow, we better pay attention to this. So we brought a national speaker in to visit with our board and our physicians. That was about 2 years ago. To say, if you're a small community hospital, you probably ought to be alert to these things that are going to be happening. These external forces is what I call them. And so we began studying that. Our board commissioned a subcommittee to begin to study that. And all of the past 2 years we've been looking at what should we do, if anything. So about, I think, December or January, that group decided that we should do something, and we should look at a partnership of some sort. Then we began to cast the net out and find out who would be interested in talking with Lewistown Hospital. We were really impressed that about 13 entities responded. So,
really?
Yes,
okay.
About 13.
See, my next question was going to be, was Geisinger the only group that you spoke with? But
oh my, no. We really had a very large group of entities, some for-profit, some non-profit. We determined early on through our board that we really did not want a for-profit corporation for our community. So we narrowed the gap by doing that. So it was kind of like a funnel. You had a whole bunch in the top filtering through the funnel, and in the end we had about 3 entities left, and the board and the subcommittee reviewed those entities and chose Geisinger as a result of the fact that it was the one nonprofit left, but also more importantly because we share the same mission. They've been in our community for 30 years. They're a name brand, the largest provider of rural health care in the United States. And they also are an integrated healthcare delivery system, which is what we need. We don't have that system that will allow us to sustain ourselves with the Affordable Care Act. So that's how we made the decision to extend this to Geisinger, and that's where we're at presently.
That's a good stopping point for us. When we come back, we'll talk about the pros and cons of a merger. We're watching For the Record on WHVL. Welcome back to For the Record. We're speaking with the President and CEO of Lewistown Hospital, Kay Hamilton. Kay, before we went to the break, we talked about some of the factors and what led you to decide to discuss a potential merger. The affordable health care was one of the things you mentioned. How much of an impact would that have on the revenues for your property?
Well, it's more than the revenues. It's an impact on how you deliver health care. The revenue reductions came through other decisions from the Centers for Medicare and Medicaid and the federal deficit reduction problems. But the Affordable Care Act presented us with challenges that we knew we were not prepared to meet. Challenges such as being able to integrate health care for a large population, population management, things that we just didn't have the resources to meet and know that we could do that. And knowing that in 5 or 10 years there were going to be penalties attached to our ability to do that. So that led us to talk with a partner.
Now, real quick to go back to Geisinger, it was the mission statement itself. Is that one thing you felt was the best blended because they do so much rural health care?
Correct, and we have basically the same mission statement in what we're trying to provide to our citizens. And they are nonprofit, and we are nonprofit, and that was very important to us and to my board.
Some of the other hospitals in the area, like J.C. Blair I mentioned before, or the Tyrone Hospital, are they also nonprofits
Yes,
as well?
Are.
And do you think you're the forerunner here of other small hospitals looking to possibly merge into other groups for that sort of strength in numbers type of situation?
I think that's what we're going to see across the United States, particularly in areas like this, absolutely. Yeah, there's really, that strength in numbers is really the only way hospitals will survive, smaller hospitals will survive into the future.
Now, what is your community, what have you heard from the community, the feedback? What are they saying about the idea of this merger?
Well, I'm hearing a lot of different things. First of all, we're doing a lot of things so we can hear from the community. We have a link on our website so people can submit questions and have them answered. We have an internal link for our employees so we can get their versions. And basically what we're hearing are 3 things. 1, what about my doctor? Will my doctor be here? What about my insurance? And what about my sister who works at the hospital? Will she have her job? So things of that nature are the primary questions. And those are very good questions and very understandable questions. So we try to respond to those for people and help them be less concerned about the future.
They are great questions, and I'll start with the first one, the insurance coverage. If someone does not have the Geisinger health plan, are they still going to be able to get care at the Lewistown Hospital?
Absolutely. We would never enter into any agreement with any entity that wouldn't, I mean, it would be senseless for us to do so and have people have to go someplace else. We want people to come to Lewistown Hospital. We want our local community to be treated locally. So any agreement we enter into with anybody, including Geisinger, will include the written commitment of Geisinger to honor those insurances.
And we should point out, you're still in the due diligence period here on both sides, correct?
Absolutely, absolutely. We have what is called a letter of intent, and that is a non-binding agreement that I liken to kind of being engaged before you get married.
Excellent. And when will you finally decide if both parties agree to it? When will there be a final decision made on this?
Well, it's very difficult to predict that because it's going to take 2 or 3 or 4 months for us to get that letter of intent into a final, very big agreement that has all the details all spelled out. When we're done with that and Geisinger's board approves it and my board approves it, then the Federal Trade Commission, the Attorney General's office will have to review all of that, and we have no control over how long that will take. And then finally the corporate members will vote on the change in ownership.
Now, will Lewistown Hospital stay the Lewistown Hospital?
We certainly want the community to continue to be recognized. The title would be Geisinger Lewistown Hospital.
Okay. Yeah. And some of the benefits for you, first of all, will you still have a job in Lewistown?
Well, thank you for asking that. Very few people do. I appreciate that. And yes, I will.
Okay. Now, some of the things that add to your strength, and certainly that'll be an able way to recruit new physicians and technicians, I would guess, more than anything else, correct?
Absolutely. This is all about growing services, and growing services means recruiting physicians and recruiting staff. So we'll have the resources to be able to do that. We'll have the resources to be an integrated healthcare delivery system so that we can care for people across the spectrum. That has a lot of meaning to all of us in healthcare, not a lot of meaning to everybody else. But it means we're responsible for your healthcare. That's what that means. Not just when you come into the hospital, but all the time. And so we have to have the resources to do that. And this alliance will give us those resources.
Now, do you think you'll be able to add extra services once the merger does take place?
Absolutely. That is indeed our plan. We want to add all the services that are necessary and needed in our community that we can't do today.
Do you have any ideas on what you'd like to, if you had a Christmas wish list, are there things you'd like to add to the place yourself?
Well, I would like to see, for example, I would like to see all private rooms. I think that would be a wonderful thing for our community to have for patient safety reasons, patient privacy reasons, and those sorts of things. Our patient rooms are very old, and it's difficult to render the care we want to render with those kinds of circumstances. So number one, I'd like to see the ED renovated completely and private rooms. And then, of course, the physicians recruited that we need, so we have 24/7 orthopedic care, 24/7 cardiology care, all those things that we need to continue for our community.
Now, do you see having to expand the campus at all?
I think we will probably need to expand to some degree in order to get all those things done, but I think the real expansion will be external to the hospital in the outpatient venue with different physician offices being opened throughout our service area is where I really see it.
Now, one of the things with Geisinger coming into the area, you have the Pinnacle Health and Hershey on one side, and then, you know, MountNittany Physicians group is sort of aligned in somewhat ways with Penn State. Do you think you were a nice catch for them because they established a beachhead here in the middle of Central PA?
I absolutely do think that. I think our location is absolutely why everybody is so interested in it. I really do. It's a perfect opportunity.
Now, with wintertime, as we sit here today, what types of things have you been impacted by with this flu epidemic?
Well, certainly our ED has been packed, as almost every ED in the country. Our ED has been very, very full. We had the highest census we've had in a long time. Just a few days ago, 105. We only have 123 beds, so that was really pretty high for us. And we've been able to manage it well. We're very happy about that. We have a lot of staff out sick with the flu, like every hospital does as well. So the flu has certainly made its impact. We've had some education for the public. We have not restricted visiting, but we have asked people to stay away if they're sick.
That's what I was going to finish up with. Have you changed your visitation rules real quickly?
No, we've not changed them, but we've asked people to please not enter if they're sick.
Okay, thank you for being a part of the Today Show. We appreciate it.
You're welcome.
You've been watching For the Record on WHVL. Thanks for watching. We'll see you again soon. Bye-bye.